Have you been feeling more tired than usual? Maybe you're always thirsty, making more trips to the bathroom, or finding it harder to concentrate during the day. These symptoms can have many different causes, including stress, poor sleep, dehydration, or certain medications. But in some cases, they may also be your body's early warning signs that your blood sugar is running higher than it should. The challenge is that high blood sugar often develops gradually. Many people don't notice the changes until symptoms become more obvious, and by then, elevated blood sugar may have been present for months or even years. The good news is that recognizing possible warning signs early can help you have an informed conversation with your healthcare provider and, if needed, take steps to protect your long-term health. In this video, we'll explore 7 silent signs of high blood sugar, explain why they happen, and discuss when it's time to seek medical advice. Let's get started. Welcome to Health Pinpoint, where we make evidence-based health information easy to understand. If you enjoy practical health tips backed by science, consider subscribing so you don't miss future videos. Feeling thirsty after exercise or on a hot day is normal. But if you're constantly thirsty, even when you've been drinking fluids, your body may be trying to tell you something. When blood sugar is too high, your kidneys work harder to remove the extra glucose. As they filter out the sugar, they also remove more water, which can leave you dehydrated and feeling thirsty more often. You might wake up during the night needing water, or find you can't seem to quench your thirst, no matter how much you drink. Of course, persistent thirst doesn't automatically mean diabetes, as other things like medications or hot weather can cause it. However, if it appears with other signs we'll discuss, it's worth bringing up with your healthcare provider. The second common sign is frequent urination. As your kidneys remove excess glucose, they also pull more water from your body. That means more trips to the bathroom. Some people notice they're urinating much more often during the day. Others begin waking up several times each night. While drinking more water naturally leads to more urination, frequent urination that seems unusual for you, or develops without an obvious reason, deserves attention. It's important to remember that urinary tract infections, prostate enlargement, pregnancy, certain medications, and other medical conditions can also cause this symptom. That's why it's important not to self-diagnose. Instead, think of this as one possible clue among several. Many people assume that if there's extra sugar in the bloodstream, the body should have plenty of energy. In reality, the opposite can happen. Your body's cells depend on insulin to help move glucose from the bloodstream into the cells, where it can be used as fuel. When that process isn't working efficiently, glucose remains in the blood instead of reaching the cells that need it. Even though there's plenty of sugar circulating, your muscles and other tissues may not be getting the energy they need. As a result, you may feel unusually tired, sluggish, or mentally foggy. Fatigue is one of the most common health complaints, and it can result from many different causes, including poor sleep, anemia, thyroid problems, stress, depression, and countless other conditions. But when persistent fatigue occurs alongside increased thirst or frequent urination, it may be worth asking your healthcare provider whether checking your blood sugar is appropriate. Those first 3 symptoms are among the most common early warning signs, but the next 4 can sometimes be even easier to overlook. Coming up, we'll discuss blurry vision, slow healing cuts, tingling in the hands and feet, and one surprising symptom that many people never associate with blood sugar. If your vision seems blurry from time to time, your eyes may not be the only thing to consider. High blood sugar can temporarily change the fluid balance inside the lens of the eye. When that happens, it may become harder to focus clearly, making vision appear blurry. Some people notice this only occasionally, while others find that their vision fluctuates throughout the day. It's important to remember that blurry vision has many possible causes, including the need for a new eyeglass prescription, eye strain, migraines, cataracts, or other eye conditions. However, if blurred vision develops suddenly, becomes persistent, or occurs along with several of the other symptoms discussed in this video, don't ignore it. A prompt evaluation by a healthcare professional is important. Our bodies are remarkably good at repairing everyday injuries, but consistently high blood sugar can interfere with that process. Over time, elevated blood sugar may affect circulation and the body's immune response, making it more difficult for oxygen and nutrients to reach damaged tissue. This can slow healing and increase the risk of infection. If you've noticed that small cuts, blisters, or scrapes seem to take much longer than usual to heal, it's worth mentioning to your healthcare provider, especially if you have other symptoms of high blood sugar. Have you ever experienced a tingling, burning, or numb sensation in your feet or hands? There are many possible reasons for these symptoms, including vitamin deficiencies, nerve compression, and certain medications. However, persistently elevated blood sugar can damage nerves over time, particularly those in the feet and lower legs. People often describe the feeling as pins and needles, burning, or reduced sensation. Because nerve damage can become more difficult to reverse if it progresses, it's important to discuss persistent numbness or tingling with your healthcare provider rather than assuming it's just part of getting older. The final sign surprises many people. You finish a meal, but before long, you're hungry again. When glucose isn't moving efficiently into your body's cells, those cells may not receive the energy they need. Your body may respond by sending signals that you're still hungry, even though you've recently eaten. Occasional hunger is completely normal, especially after exercise or a lighter meal. But if you frequently feel unusually hungry, despite eating balanced meals, and especially if this occurs along with increased thirst, frequent urination, or fatigue, it may be another clue worth discussing with your healthcare provider. The symptoms we've covered today don't automatically mean you have diabetes. Many other medical conditions can cause the same signs. That's why it's important not to diagnose yourself based on a single symptom, or even several. If you've noticed multiple changes that are new, persistent, or worsening, schedule an appointment with your healthcare provider. They can review your symptoms and determine whether blood tests or other evaluations are appropriate. Early detection of elevated blood sugar can make a meaningful difference. In many cases, lifestyle changes, medications, or a combination of both can help people manage their blood sugar and reduce the risk of long-term complications. Paying attention to your body's signals is an important first step, but getting an accurate diagnosis requires a medical evaluation. Let's quickly review the 7 signs we discussed today. Increased thirst, frequent urination, persistent fatigue, blurry vision, slow healing cuts, tingling or numbness, feeling unusually hungry. If you found this video helpful, please give it a thumbs up and subscribe to Health Pinpoint for more evidence-based health information designed to help you better understand your body. Have you learned something new today? Let us know in the comments which topic you'd like us to cover next. Thanks for watching, stay informed, stay healthy, and stay tuned for our next video.